First, another story we're looking at on the programme, and some good news from the World Health Organization, which has announced that malaria has been completely eradicated in Egypt. That's a goal the country has been trying to achieve for the past century. The WHO calling that truly historic news. Julia Seeger, our science editor, who's with me now. And when they were talking about it, the head of the WHO actually reminded viewers that malaria is as old as Egyptian civilization itself.
That's right. Malaria is actually deep-rooted in Egyptian history. We have proof of the disease dating back to 4000 BC to the times of the pharaohs. And we even have genetic traces of the disease in Tutankhamun and other mummies. We have written testimonies that the disease was indeed endemic at the time of the pharaohs. Now, we say that it's a century-long effort, and the reason why is because the first documented efforts that we have to battle malaria dates back to the 1920s. They wanted to really reduce human-mosquito interactions, so they banned the cultivation of rice and crops near residential areas. In the 1930s, they made malaria, they classified it as a notifiable disease, meaning it became mandatory to report contaminations. And by the 1990s until the early 2000s, they really had managed effectively to control malaria, but there were still hotspots here and there, like we saw, for instance, until 2014. And the reason why the WHO has now declared Egypt as malaria-free is because there hasn't been any new cases of malaria on a nationwide level in the last 3 consecutive years.
And look, how did Egypt do it then? As you say, this has been a 100-year-long project, but there have been particular efforts made in the past few decades.
That's right. They did what every other country does when they eradicate the disease. That's what China did, for instance, when it eradicated malaria in 2021. They had a global approach. So first, when it comes to Egypt specifically, they really focused on the control of mosquito vectors. That means spraying insecticides and draining wetlands and marshy areas. Now, they intensified efforts depending also on the region. They intensified a little bit more in the south of the country because it's closer to the Nile River and there's a lot of marshland there. And they also monitored the border controls and the borders, especially with Sudan. There were large-scale prevention campaigns as well. They distributed insecticide-treated mosquito nets, and they adopted the motto that we all know today: it's detect, trace, and treat. When it comes to treatment, they had lots of different types of anti-malaria drugs. They had quinine-based treatments. They also developed artemisinin treatments as well. And last but not least, because this is going to be important in the decades to come, they really improved the health infrastructure in a big way because, that's the crux of the matter. Here for now, they're malaria-free, but they're going to have to keep that and really maintain that effort in the next decades to come.
And as you say, look, it's not just Egypt. 44 countries, 1 territory have now been officially certified as free of malaria.
That's right. But the list changes every year, of course. We're going to see it on the map. But in dark green, you're going to see all the countries that have recently eradicated the disease. So you see that there's Cape Verde, there's Tajikistan, China, Argentina, Paraguay. Then in light green, it's the countries that are in the process of eradicating malaria. And in red, it's still places where you still have clusters. Now, of course, the global south is where you have the most mosquitoes, and this is why it's where the regions in red are still located. But you have to understand that it still kills a lot of people. Even if we can treat it, it kills 600,000 people every year worldwide. But 95% of those deadly cases are actually in Africa. And if I go a little bit further than that, more than half of the deadly cases are in only 4 African countries: Nigeria, the DRC, but also Tanzania and Mozambique. Now, the good news is that 2 different vaccines have been rolled out in most of those countries, so it's going to help eradicate the disease, but they're going to have to keep up the good work with vector control efforts, as we've seen with the case of China and with now the case of Egypt.
All right, Julia Seeger, thank you very much.